Hi, guys, and welcome back to another episode of Building Forever. I'm Kristen Simmons.
And I'm Ryan Simmons, and we're the owners of Forever Young Frankfort.
Today, we're talking about the stigma around HRT. So, why do you think there is a stigma around HRT?
I think there's many factors. I think the big thing is that most people think that testosterone is a steroid and it's sort of revolves around the bodybuilding world and you're going to get huge and all these things. Where the reality is, you're only trying to optimize your hormone levels, so you're really trying to get to the point where you were when you were younger, when you're in your mid 20s or 30s. So it's not huge amounts like these massive bodybuilders like this. Just not even on the same level. I think that's the big thing. I think also, as in general, men and women, they have to take, a look in the mirror and understand they're getting older. And sometimes it's hard to accept that, your body's changing. And most men, I can speak, from a men's perspective, is they wait too long because things happen gradually. Maybe they sleep poor, strength's reduce, their stamina's decrease over time, little by little, and they just let it go. And it gets to a point where you sort of don't even remember what it was like to have, high stamina and good sleep. You sort of forget over time. And so I think that's the stigma is acceptance of where you are and thinking that you can't improve your life, you can't get better. A lot of people, honestly think that diet and exercise alone will do it. And the reality is it won't do that. It won't bring your levels back up to where they were when you were younger. So there's all these stigmas, and I think a big part of it too is just society in general. Especially in the media and celebrities. There's celebrities that think HRT, but they don't really own up to it and talk about it openly. There are a few that have. We'll talk about a couple we've noticed that are actually accepting and they're open about it and talk about it in the media. But most aren't. Most feel like I think the other thing is too is they think it's like cheating. It's like a quick way out. It really isn't. It's just literally bringing your body back to a natural level. And it's very funny to me that people go to the doctor and they'll take a pill in a heartbeat. And I think that's the other problem too, is it's an injection. So injections, I think, are a little more invasive. So people think, oh, it's injections, but people will take a pill for anything.
Yeah, and I guess from a woman's perspective, as you said, as you age, people try to avoid it, right? And so once menopause starts happening or even perimenopause, women just they certainly dread getting older, but there's just like so much negative talk around aging once you kind of get to midlife. And instead of doing things to make it easier on yourself, women say it's just a part of getting older and it's unfortunate and it has to be miserable rather than trying to optimize their levels and make life easier on themselves. And I guess from my standpoint is HRT is bioidentical. So it's the same testosterone that your body is going to be producing naturally. This is a natural treatment. My confusion when it comes to women and hormones is why it is so accepted to put young women on a synthetic hormone, the pill and birth control methods at a young age, like 13, 14, 15, to try to mitigate the negative symptoms of getting your menstrual cycle, avoiding hormonal acne and avoiding all of the emotional aspects of it by suppressing those hormones with a synthetic version, which often makes everything so much worse when that's really the time in your life to be optimizing your hormones with diet and lifestyle. But it's so accepted to put young women on synthetic hormones, which they'll stay on for 5, 10, 15 years until they're ready to conceive. And then they have issues conceiving and then their hormones continue to be messed up until they get to menopause. And so I feel like it's so accepted to give young women synthetic hormones, but it's less accepted to age gracefully and naturally by supporting and optimizing your levels as a young woman who was put on birth control at a young age and was on it almost 10 years, and getting off that was a whole thing for me. And I did turn to diet and lifestyle to come back from that. And I now coach other women going through PCOS, like the same thing over and over again. So I guess from both of our standpoints, that is really why we're so passionate about this topic, is because of our personal experiences, but also because you have seen the positive impact it's had on your life. And it just so happens that we're also bodybuilders. But yeah, that stigma for men and even women to be like, oh, it's testosterone and taking testosterone. And they think they're going to get huge like a bodybuilder.
And I don't think most women actually know that when you talk about hormone replacement, that testosterone is a part of it. It's really the base. And I had someone call the other day and they said, yes, my doctor put me on an estrogen patch and progesterone. And I said, no testosterone? And they said, no. So that shows you that, really what the medical community maybe isn't as well informed about hormone replacement as some people outside of that space who work with it, on a daily basis. So I think that's a big part of it. And you brought up your point about, young women on the pill, and you think about how that's impacted their lives today, because I know from a man's perspective, we're seeing guys come into clinic under 30 with low testosterone levels. And so that always has to do with the lifestyle. That has to do with the, food, the chemicals in the food, the things they're eating, the amount of obesity that's in the United States. And so I think that's really impacted it. And there's studies out there now showing that, men of today have much lower testosterone levels than men did 40 years ago. So obviously there's impact from outside environmental factors that are playing a role in that. I'm sure it's the same with women. Women have taking hormones young for birth control, and also obesity, overeating, all these things impact your hormone levels, and that's what we're seeing in men. Definitely lower testosterone at a lower age, and certainly women are seeing early menopause. We're seeing things that happen that shouldn't be happening right away. So that's obviously outside factors that are here. Hopefully, part of our whole health and wellness journey is to help people improve the food and improve at an early age if possible, so they can start limit these things that are happening in the future.
But like you mentioned earlier, just changing your food isn't going to increase your testosterone levels as you age. Those are going to continue to drop off. But if you improve your lifestyle and you do HRT, I feel like that's where the sweet spot is, and where you're absolutely going to look and feel your best, because food and exercise are the two most important and controllable medicines that you take daily. That is so underrated, I feel like. And like you said, people are just so quick to take pills, but they're not willing to change their diet and lifestyle.
Yeah. So the stigma, as you mentioned earlier, it really hasn't helped any by sort of the celebrities in the world who really are doing these things, and they don't, whether it be aesthetics or also hormone replacement, they're not admitting to it. They're sort of saying that somehow they're outside of the realm of normal people and they don't age and they don't go these things everybody else does. But there are some certainly men that are doing it. They claim they don't do, like The Rock and Hugh Jackman and these guys who are doing these movies who get in great shape, and they say they're doing it naturally, which obviously isn't the case. But luckily, people like Joe Rogan's been very, very vocal about it, and he's said he's been doing it for 10 years. He started when he was 40. So that helps a lot of guys. He's a celebrity, but he's also sort of a normal guy. For that matter, he's not sort of one of these celebrities that are untouchable and sort of in their own little world. And he really opened up the perspective to men to be able to say, hey, it's okay. It's okay to do this. It's not negative to be adding these this supplementation to your body to help optimize your hormones. So individuals like that. So more of those need to come out to sort of help men who are on the fence about doing it, to really push them over and get them to feel their best. And I think, Kristen, from your perspective, there's some women too, I think, that they're doing the same thing.
Yeah, I mean, one that comes to mind is Halle Berry. She's very open about it, which I think helps inform women who are aging. It's only going to add value to your life to optimize your hormones. And I guess the other one is from the aesthetic side is Lindsay Lohan. Like, she recently did Morpheus 8 and was open about that also. And like, there was a dramatic difference in her face. Like, she had other things done, but I feel like there was a lot of spotlight on her for a minute about the aesthetic side of things, like all the things that she did, and she looks amazing. There's nothing wrong with utilizing these treatments to help you look and feel your best. I think some people look at it at the angle of they're not good enough or they need to change who they are, whereas really these are just tools like anything in life to help you look and feel your best and be forever young.
Yeah. Exactly. The doctor tells you you're low in iron or you're low in magnesium. What do? You take supplements for that. I mean, it's so simple. It's not, you're not doing anything negative. It's something that your body is naturally low in testosterone, and for a male's perspective. And so why not supplement that into your body? So it's pretty simple. I'm not sure. Yeah, I think it's definitely changed over the years. More aware. People are more aware of the benefits, and the negativity. I think is gone. The stigma is starting to go away, but we're still trying to push it forward and make guys aware that that is happening. And again, it's happening at a younger age too. So, people have to also look earlier in their life on, how to maintain a healthy lifestyle. They're eating and exercises to make sure they minimize this happening. Because certainly, if you can go longer in your life without having to add testosterone, then that's a benefit. We're not saying to anybody, come in and we want to add testosterone when you're 25. Well, that's what we want to do. We would rather have guys come in when they're 45 or 50, when they really should be adding it, versus their younger ages. So, and that's just lifestyle, and hopefully in the future it'll get to that point. But right now, like you mentioned, men are coming in much earlier because of this, and so we're just trying to help, make the rest of their lives as comfortable as possible and feeling their best. So.
Do you think men or women are more hesitant or like caught up on the stigma?
Honestly, I think it's men. I mean, based on what we're seeing in the center, like women are becoming more they're more aware. And I think it's part of this because women typically do more research on things and they understand it better than men. Men typically they jump into things or they'll wait too long, or they don't necessarily know the ins and outs. And sometimes they take the easier route, which men will typically do things like just buy testosterone online and they just treat themselves. And men just typically have that type of mentality where they don't want to really ask for help. They don't want to really let the world know that they're struggling in the bedroom, or trying to sleep at night, or just or mood swings, or these things that happen. So I think they internalize a lot of things, and that's why they tend to take longer to get on a good program where they're coming in somebody where they're following the blood work and they're really trying to optimize things versus just sort of hit and miss by injecting some testosterone every once in a while. So, but I think women are much more aware, and they do the research, and I think they understand. And I think they're probably, I can't speak for women obviously, but I feel like the women's symptoms are probably more severe than men's symptoms are, especially later as it close to menopause. I think that's maybe the difference a bit. Men can typically deal with it and just not be as happy. But I think women, maybe have more severe sometimes. So that's why they tend to. So we're definitely seeing more women coming in and getting on the program right now. So
I think you sharing your experience certainly is a benefit, like you being able to talk to men that come into the center, and then same with Rachel, our nurse practitioner, like she has a firsthand experience with it also, and also influential people in the world, like celebrities, like the more that they talk openly about what they're doing to look and feel their best, it only helps get the word out. So
yeah.
But to your point, like where age is concerned, especially for younger men and women, like for instance, me, I'm going to be 31 next week, but I'm obviously not close to menopause, but it is beneficial to now start looking at blood work. I mean, I already do because of our competition preps, and it's good to keep an eye on our levels. So that's something I'm already aware of. But most women really don't even take a look at that until it's too late. So to keep an eye on it from age 30 to 35 to 40, and kind of being able to kind of track it as you age, so you can really get ahead of it and you can see where things do start to drop off. So us being a hormone optimizing center and having access to these comprehensive panels is so beneficial for anybody really age 30 and up, because the more aware you are of what's going on inside of your body, you're able to make sense out of how you're feeling externally. So I guess bottom line, whether you're a man, whether you're a woman, feeling your best is not selfish. It's quite the opposite, because the better you feel, the better you're going to show up in your life in every role, as a wife, as a husband, as a mother, at your job. The better you're feeling, the better you're going to show up in life. And I feel like showing up as your best self is the greatest gift that you can give anybody, honestly. So if this conversation today resonates with you in any way, our DMs are open. Feel free to call the center, set up a consultation with Ryan, with our nurse practitioner, Rachel, and we can get you in, get your blood work done, see where you're at. It's a very quick and easy process. We make it so accessible for everybody, and we even take insurance for blood work.
And you can enjoy the rest of our services as well. We have a full aesthetics center and also yoga and Pilates.
We also have health coaching now. Ryan and I are both offering one-on-one longevity coaching if you need help with your diet, exercise, lifestyle. Summer is coming and we are here to help you look and feel your best. So thanks for tuning in for another episode of Building Forever. I'm Kristen Simmons.
And Ryan Simmons.
And we'll see you next week.